Don't make this exam harder than it needs to be. I get so many comments about this exam being hard. I get so many comments about this exam being tough. And I just feel like I don't want you guys to make it any harder than it needs to be. This exam is not, what do they say, rocket science? This is not rocket science. What is up, YouTube? It's your boy Zed, back at it again with another video. Today we're going to go over some practice questions for the CNA exam, specifically for the CNA exam that you guys have coming up. If you didn't know, I am a almost 2.5 year CNA, and I post videos about nursing school. I post videos about being a CNA, and I post videos just simply about being in healthcare along with lifestyle content as well. So if you are new to the channel, make sure you check out some more content to see if you would consider subscribing. And if you are a returning subscriber, then welcome back. We have a great video coming up for you guys right now. Shout out to the channel for almost growing 6,100 subscribers, which is crazy because I remember when we only had 1,000. It's growing a mile a minute. I cannot say that enough, and I'm so ready for us to hit our 10,000 mark. But I'm gonna just keep posting until we get there. But in this video, I have it all on my iPad so I don't get off track. But I have a list of questions that will help you for the CNA exam. So if you're worried about the CNA exam, don't be. I don't think it's a hard exam at all. I passed on my first attempt with not a lot of complications or issues at all, but I also practiced very well. And these are some of the questions that I did practice, because a lot of times you'll see these questions and they're just reworded in a different order. And a lot of times you'll see these questions and they're reworded or just in a different order. So it's not a hard exam at all, and I think you guys got it. But without further ado, let's go ahead and get into these questions. So I'm going to start out with the first one. Which of the following is the best way to prevent the spreading of germs? A, wearing gloves during patient care. B, wearing a mask and gloves with patient care. C, hand washing before and after patient care. Or D, wearing a gown, mask, and gloves while performing patient care. Which one do you guys think it is? Yeah, the answer is going to be C, hand washing before and after patient care. And the reason that it is, a lot of these exams, they have a lot of right answers, but you want to make sure you're wearing gloves during patient care. You want to make sure that you are wearing a mask during patient care. You want to make sure you're protecting yourself during patient care. But this question is asking, what is the best way to prevent the spreading of germs? What's the best way to prevent the spreading of germs? And that's going to be hand washing, hand washing, hand washing every time. That's before and after patient care. The second question that we have is going to be, which of the following is a example of subjective information? A, the patient's pain level is 7 out of 10. B, the patient's temperature is 101.2. 3, or C, the patient had eggs for breakfast. Or D, the patient's blood pressure is 120/80. First, before you answer this question, you have to know what subjective means. Subjective is means it's not a fact. It's allocated or specific to you. It's something that's not a fact, first and foremost. And patient's temperature is definitely a fact. You've taken that. Patient had eggs for breakfast. I can visually see the patient had eggs for breakfast. Or D, the patient's blood pressure is 120/80. If you take his blood pressure, that's his blood pressure. That's a fact. That's not subjective. The patient's pain level is 7 out of 10 is the only right answer, is A. And the reason that it is A is because that is something that you cannot measure. You can measure everything else. You can't measure his pain or her pain because that's subjective to them. The third question is going to be, you have a patient that is on a bowel regime but has not had a bowel movement in 4 days. What is your next step? A, report this to the charge nurse. B, give the patient orange juice with Miralax. C, encourage the patient to drink more water. Or D, nothing. It's normal. The only answer for this is going to be report this to the charge nurse. As a CNA, you have zero clearance to do anything evasive or anything that is going to alter the patient in any kind of way. You don't want to give the patient Miralax. You don't want to encourage the patient to drink more. That's the nurse's job to get with the doctor and see what the plan is. But you want to report any change in a patient to the nurse that is allocated to that room, to that patient or whatever. Report it to the nurse because you're just the CNA. It is out of your scope of practice to do any of the other, choices that's in this. So report it to the charge nurse. Next question I have is the patient is lying in the supine position. In what position is the patient's bed? A is 90 degrees. B is flat. C is tilted upside down at 30 degrees. Or D is 45 degrees. In your CNA class, you will learn what different bed positions or lying positions. And supine means flat. 90 degrees means sitting up 90 degrees. And it's pretty self-explanatory. Supine means flat though. Flat on their back. That's the supine position. So, yeah. That's the answer for that one. It's B. What is one reason why performing postmortem care is essential? I've done a video on this too about postmortem care, so go check that out. But it is questions is what is one reason why performing postmortem care is essential? A, there is no need to perform postmortem care. B, performing postmortem care ensures the staff feels good about themselves. C, one reason postmortem care is essential is because it's legally required. Or D, postmortem care is crucial in maintaining the dignity and respect of the patient. The answer for this one is going to be D. Like I said, there's a lot of right answers and wrong answers. There's always need to perform postmortem care. A lot of times you can decipher what the right answer is by crossing out what doesn't sound right at all and then picking the last two. You want to do what's best for the patient in all cases. So postmortem care is essential for the dignity and respect of the patient before they are placed into a bag and sent to the morgue. That's how that works. The next question is going to be, you're assisting a resident with ambulation. The patient uses a cane for ambulation. How should you assist the patient? A, stand on the same side as the cane. B, stand on the patient's weak side. C, stand behind the patient in case they fall. Or D, walk backwards in front of the patient so you can see if they fall. The only answer for this one is going to be B. Stand on the patient's weaker side. If they have a cane, they are supported on whatever side they have that cane on. If you're helping a patient with ambulation or you're ambulating a patient, a lot of times they want you to have a gaiter belt for them, which is around their waist, that you can keep a hold of the patient and hold them up if needed. But also at the same time, if they have a cane and they are ambulate, all you need to do is just support their weak side. Typically with stroke patients, they have a weak side and you want to make sure you hold them up on that side so they can support themselves with their strong side. That's how that works, and that's the right answer. So next question. If a patient wakes up confused or delirious, this is a sign that indicates what? A, the patient is in a great deal of pain. B, the patient is receiving too much sleep during the day. C, the patient's sugar levels are not online. Or D, the patient is not getting enough oxygen to the brain. A lot of times if you wake up and a patient is, confused, delirious, that is a sign of D, the patient is not getting enough oxygen to the brain. But the reason it is because it could be that or UTI. But this question didn't mention a UTI. It only mentioned that a patient is not getting enough oxygen to the brain. And when a patient does not get enough oxygen and oxygen is not reaching the brain the way that it should, it can cause a patient to become, delirious, confused, non-coherent, and typically just out of it. You could they in the healthcare field, you'll get a report from the nurse or you get a report from another tech and you'll ask them, A and O's, are they alert and oriented? Sometimes they could be alert and not oriented. Sometimes they could be oriented and not alert, which you don't really see much. But if they're alert oriented, that means that they're with it. They know what's going on. They know where they're at. They know what's happening. A lot of times that is how you would indicate if they are. But with sundowning, you'll see a patient begin to be a little bit confused, a little bit disoriented. But that's not the norm. The answer for this question is going to be D. So next question is going to be, which of the following options is not acceptable when changing a patient's linen? A, folding the contaminated side on the linen inwards. B, placing the contaminated linen inside of a plastic bag. C, placing the linens on the floor while changing them. Or D, changing the contaminated linens immediately. So this question is asking which is not acceptable, and the only answer for this one is going to be C, placing the linens on the floor while changing them. They don't want you to contaminate the room that way. Or if you're changing a patient who just had a BM or urine and you throw it on the floor, it's contaminating the floor that, nurses, doctors, family walk on, which can then track on shoes and get into the entire hospital. You can get it in different rooms, different units, places that should be sterilized, and the foot traffic that the hospital gets is crazy. So it can be passed on to the next person that walks over that. It's just a way to, kind of mitigate whatever issues they have with contaminating the space of the hospital, because it's supposed to be relatively clean, so the patients can react well to a relatively clean environment. But if you throw it on the wall or throw it on the floor, then it contaminates the room and people start touching it, people start touching other things, and it just spreads that way. That's how bacteria spread. So yeah. What should a nursing assistant do when he or she notices warning signs that a patient may be developing a bed sore? A, immediately report the warning signs to the nurse. B, administer the medication that is used for the healing bed sores. C, monitor the warning signs to see if they get worse. Or D, ignore the warning signs until a bed sore actually develops. The only answer for this one is going to be immediately report the warning signs to a patient's assigned nurse. You want to tell the nurse any change in the patient. If you're changing a patient, you realize, hey, there's a little bit of redness on this patient's, bottom sacrum. I just want to let you know. They'll ask you to sometime get a sacrum pad. You guys will assess the area, put the sacrum pad on there, and date it, whatever initial date. And that's the nurse's job to do. So you want to make sure any change in the patient, you want to go ahead and tell the nurse. And anytime that's an option on the exam, you want to choose that one. The next question is, which of the following options is the most effective safeguard used to manage infections in a patient and the workforce? A, immunizations. B, TB screening. C, isolation. And D, hand washing. This goes back to contamination control. You want to make sure you're washing your hands. Not washing your hands can contaminate a lot of areas. You touch something crazy, you touch a wall, you touch a door, it's passed on to the next person. So the way to do that is just to wash your hands. And before and after patient care, another question that will be on your exam, you need to be washing your hands before and after patient care. That's the best way to make sure you're not spreading germs. Which of the following terminology definitions is false? A, delirious is when an individual is in a state of confusion. B, tachycardia is when an individual has increased pulse. C, hypertension is when an individual has low blood pressure. Or D, void is when an individual urinates. Let me give you guys a second on this one. The answer for this one is going to be hypertension is when an individual has low blood pressure. If you're delirious, you are in a state of confusion. So A is definitely not wrong. B is tachycardia is an increased heart rate, increased pulse. Bradycardia is low pulse, low heart rate. So these are, medical terms will pop up in your exam. And if you know the medical terms, you can kind of really cancel out some things. I know that tachycardia is increased heart rate, increased pulse. So I know that one is chopped. The only one that makes sense is hypertension is when an individual has low blood pressure. And I guess hypo would be when a hypertension is when a patient has high blood pressure. That's hyper. Hypo would be low blood pressure. So, this would be false. That's why this is the answer. What is the term for a device used to take the place of a missing body part? A, abduction. B, pronation. C, external rotation. Or D, prosthesis. The answer is going to be prosthesis. This is basically like orthopedic units is where your patient will receive a prosthetic, which is to replace a body part, whether you need a prosthetic arm or leg. Typically it's a leg, especially with cardiac patients. But yeah, prosthesis is going to be the right answer. Just simply, it can be made like it's to improve a patient's quality of life. If they can get a prosthetic, leg or arm for their body, once it becomes an amputee. So that's why this is the right answer. And if you want to become an ortho nurse or ortho tech, It's a heavy unit. I'm giving you a heads up, but there's a lot to learn there for sure. So keep that in mind. To lift an object using good body mechanics, the nurse should A, keep both feet close together, B, bend the knees and keep the back straight, C, hold the object away from the body, or D, lift with abdominal muscles. The answer for this one is going to be B, bend the knees and keep the back straight. That's just simple body mechanics. I didn't even have to study to know that this is the right answer. To use some of the like canceling out of answers. Keep feet close together is never a good thing. You want to make sure you have a wide base when you're lifting heavy. I knew that from lifting weights. C is going to be hold the object away from your body. No, the easiest way to lift is to keep your back straight is to hold it close. Because if you're holding it like this, you're leaning forward a little bit. So that makes sense. And then lift with abdominal muscles. It's just the best answer choice for this one is going to be bend the knees. It's going to be bend the knees and keep the back straight. Insulin, a hormone, regulates what? A, the amount of salt retained in the blood, B, the strength of the skeletal muscles, C, the rhythm of the heart, or D, the amount of sugar in the blood. I knew this simply by working as a CNA. I don't have anybody in my family that I think struggles with a high sugar level to the fact that they have to receive insulin. I haven't seen that, up close and personal. But when I started working in healthcare, you do sugar checks all the time. You do blood sugar checks. I want to say if they are Q4, you do it every 4 hours, and if they're ACHS, you do it once at. I work night, and ACHS is simply 9 p.m. and 6 a.m. So you want to make sure that you're checking it at least 2 times a shift if you work in a hospital or a nursing home, to make sure that their blood sugar stays intact and to make sure their blood sugar stays good, stays well. So if the blood sugar is high, they got to receive insulin, and it brings down your sugar levels. Sometimes they're at 320, 280, 290. Sometimes they got to receive, some insulin to drop that, because if it gets too wonky, that's not good for the patient at all. And the next question is going to be, when taking a client's radial pulse, the nurse aide's fingertip should be placed on the client's what? You guys know the different pulse places to take the pulse. So the answer for this one is going to be wrist. Your radial pulse is going to be on the wrist. Absolutely on the wrist. I don't really have to get too much into this one, but if you study and you study your anatomy, then this is like one of the first things they cover in anatomy. You really can't forget this because it's so simple compared to the other things you're learning in the class. Just keep that in mind. If they're checking the patient's pulse, radial pulse, know that it's going to be on the wrist. Next question. To take an oral temperature, the nurse aide should what? A, place the thermometer in the rectum. B, place the thermometer under the arm. C, place lubricant on the thermometer, or D, place the thermometer under the tongue. The answer for this one is going to be D. The best place to take a patient's temperature is going to be under the tongue. Unless they're a baby, I think rectum is the best place to take it there, but I don't work too much with kids, and I've been in the field for about 2 years now, so yeah, that'll be the answer for adults. You want to take it under their tongue. I asked this one on a short before, so let's get into this one. NPO means what? A, nothing by mouth. B, nothing by mouth except water. C, only ice chips in mouth. Or D, nothing per ostomy. Ooh. The answer for this one is going to be nothing by mouth. A lot of times, if a patient hasn't passed a swallow screen, or they're new to the unit, you don't want to give them anything because you don't know how they're going to react to it, if they're going to be able to swallow it, water or food, or they have an NG tube, then they can't have anything anyway. But the answer is going to be nothing by mouth. That's what NPO means. You can't forget that. You cannot forget that. That's a common thing. Like, you'll see that a lot in healthcare. And if you get on a unit and a patient starts asking for a bunch of like food, water, I need this, I need that, you cannot give it to them without confirming that the patient is not NPO. Sometimes they're NPO before, the morning time, so they go NPO at midnight because they have a procedure. They're not supposed to eat anything. Keep that in mind. A lot of times if you're doing Foley care, you want to make sure you hold it at the base to clean it. But a lot of times it'll be attached to their upper thigh because they don't need that thing being pulled on, being pulled out. It's not a pretty sight, and it's not comfortable. It's not comfortable for the patient at all. So you want to make sure you are being careful when pulling that thing to clean it, or if you want to make sure you be careful when moving a patient around, because it's not good to have that thing fall out. They'll be looking at you like, what are you doing? Keep that in mind. So the next question is going to be, the purpose of padding side rails on the client's bed is to what? A, to have a place to connect the call signal. B, to keep the client warm. C, to use them as a restraint. Or D, protect the client from injury. A lot of times you will use this with a seizure patient, and the only real answer for this one is going to be D, protect the client from injury. You don't want the patient to seize out and then start hitting on those plastic rails. They can harm themselves and cause even more damage to their body than it needs to be caused. So the answer for this one is going to be D. You're protecting the patient from themselves if they were to seize, and it's just better comfort for the patient if they do begin to seize. And yeah, those side rails are hard. Like, you'll see it. Those side rails are hard. Don't make this exam harder than it needs to be. If I leave you guys with any advice, and I'll probably push this to the beginning of the video, is I just went over all those questions with y'all, and I want to say 60% of them were just like, you can look at them and find the answer within like 5 seconds. I get so many comments about this exam being hard. I get so many comments about this exam being tough. And I just feel like I don't want you guys to make it any harder than it needs to be. This exam is not, what do they say, rocket science? This is not rocket science. This exam is the base level to the nursing industry, and you are very capable of passing it on the first try. Study, whatever test anxiety you have, figure that out, because it's not hard to do this on the first try at all. And I just went over these questions with y'all, so yeah, I hope it helped. I do plan to do more, because this was only like, 15, 16, or 17 questions. It wasn't a lot. So make sure you guys stay tuned, and I will work with you guys on more. Program starting up soon, so look out for an update on that. But I wanted to make sure I start 2024 off right with just helping you guys with this. This is not hard. Doesn't need to be tougher than it needs to be. But I hope this video helped, and I will see you guys on the next one. All right. Peace.